Good afternoon. I'm Larry Luck. I'm one of the business analysts here at TMCx. I have the pleasure to work with these companies on a daily basis and am just extremely invigorated by the way that they're transforming this industry. I'd like to introduce one company in particular now. Valera Health is a company focused on the current crisis in behavioral and mental health care. 1 in 5 Americans, or 42 million people in this country, suffer from a mental health condition, and half of those are undiagnosed or uncared for. Now, whether diagnosed or not, these patients present a tremendous cost to the healthcare system because our most needy and highest cost patients are comorbid with medical and mental health conditions. To frame this problem yet another way, the New York Times recently published that suicide rates in our country have reached a 30-year high. So Dr. Thomas Tsang, the founder and CEO of Valera Health, saw an opportunity to use technology to amplify behavioral health services and disrupt the way that we approach mental illness. He's put together an exceptional team of data scientists, policy experts, behavioral health specialists, and engineers to solve this problem. He's an internist by training, and as the chief medical officer of a federally qualified community health center in downtown Manhattan, has implemented a behavioral health model to serve 40,000 patients. He later served as a congressional staffer on the House Committee on Ways and Means, contributing to the Affordable Care Act. He was the medical director to the Office of Health IT and chief medical officer at Merck in the Services and Solutions Division. So it is my pleasure to introduce Dr. Thomas Tsang.
Good afternoon, everyone. Good afternoon. Thank you. Thanks a lot. I'm Tom Tsang. I'm CEO and co-founder of Valera Health. And as Larry so graciously introduced me, we have a really bad crisis at hand. Half of the country are short of providers. We need 3,000 psychiatrists just to fill the void. And in Texas alone, we need 1,000 psychiatrists. And what does that translate to? So we have patients who are the neediest and highest costs in the system that have comorbid medical conditions and mental health conditions costing 3 times more than patients with just pure medical conditions. And what we're seeing is really the consequences of all this is that payers and providers and governments recognize this problem, are actually making a huge effort and initiative in terms of getting care to these patients. And what are we trying to do? At Valera Health, we're reinventing behavioral health services through the use of data-driven and technology approaches added to human coaches. So we have 4 components. One is using population analytics to actually identify these individuals and risk stratify these people. And then we ask them to download an application on the cell phone that actually captures data and finds out exactly how they feel and sense exactly what's going on. And then we do care coordination using human coaches to actually work with these people and deliver light touch cognitive behavioral therapy and coordinate activities and telehealth visits. So a little bit more about each functionality. So in terms of the analytics, we work with payers and providers to actually identify the right care for the right patients. Not every single individual needs to see a psychiatrist, and we can actually manage 60% of these people with CBT right through the application. The application itself captures information directly from you and about you. We can get consent from the patient to collect passive data directly from your cell phone. So we collect light, your geolocation, the pitch of your voice. And the idea is to put all this information together and understand changes that would actually get you the care that you need early on to avert a costly and bad outcome. And then we actually deliver content through the application, where coaches can actually work with you, coordinate appointments, remind you on medications, and actually help direct your goal planning in terms of mindfulness training, stress reduction. And then lastly, we coordinate and work with individuals and actually coordinate schedule telehealth visits with provider organizations. And so in essence, we have all the components in an end-to-end solution to amplify existing models at least threefold. So the value proposition for the patient is that there's accessible private care in the comfort of your own home, and you're totally linked to the care team. The value proposition for payers, they actually meet the requirements of the Affordable Care Act and provide timely service. And the value proposition for providers, you actually can have a sustainable, efficient model to take care of the needs of your marketplace and gain access to new markets through telehealth reimbursement models. This is a huge opportunity to disrupt. There's $106 billion that were spent in 2015 for inpatient and outpatient services. And think about it, if we just get 1% of the marketplace, that's $1 billion in 5 years. We've been very, very fortunate. We've only been around for 1 year, and we've gotten 2 customers with revenues of $350,000 this year, and we're projecting revenues of 1.7. And our business model is based on a PM pricing model, but ultimately we like to take risk. So we've been working with some of the most elite organizations around the country. We're doing a clinical trial with McLean Hospital connected with Harvard, working with a group of schizophrenics. We're working with Montefiore Medical Center and their comorbid conditions patients in their Pioneer ACO model. And now we've just come up with a proposal with the city of Louisville. So join us in reinventing behavioral health and help us to help others. Thank you.